Thank you, and good morning. Truly a pleasure to be here with you. I must say, diabetes is something that's important to me, and I'm sure important to you. I'm going to try to get comfortable, so I may be moving around this morning, but I am going to make my way up. As I understand it, we're going to have about 20, 25 minutes to talk and a little bit of Q&A. And at that point, we'll wrap it up. But my name is Dr. Darryl Hill, and I'm a board certified internist. I've been practicing, I know I don't look it, for over 20 years. And I started practicing in Laurel, and I've been here in Montgomery County as well. Originally, I'm from New Jersey, attended Rutgers University, and ultimately went to Rutgers Medical School as well. And today, we're going to be talking about diabetes. So let's go ahead and get started. So the objectives of today will give a little bit about background on diabetes. We're going to talk about some demographics. We're going to talk about some of the causes of diabetes too. We're going to really look at the more traditional causes of diabetes and look at some of the other things that we don't talk about but are just as important. Ultimately, we're going to give a brief review of some of the best ways to manage diabetes because that's important too. And as we get into the conversation, I really hope that you can all begin to appreciate how much maybe, despite how smart we are, how much we haven't been taught about nutrition, about food, and really what are some of the real drivers of diabetes. So it's important to think about diabetes as people who you know, your family, your friends, and diabetes is real. So I wanted to really start off by making sure we appreciate the significant rise in number of diabetic cases and as far as the number of complications that we're seeing. Diabetes, we all should know, can lead to blindness, heart disease, heart attacks, dialysis, and amputations. And one of the things I told myself about 3 months ago was I really want to make sure I'm getting out into the communities and talking to people because, to be honest with you, we're just seeing some really destructive cases of diabetes right now when it comes to complications. In the past 3 months, I've seen 2 people at my first time meeting them having to send them to the hospital to get their legs amputated. And that's real. We're at that part. And sometimes I think we can forget about just how serious diabetes really is. And the good side to all this is I'm getting people now who get diabetes or pre-diabetes, and we're able to reverse it and make their diabetes kind of go away. And that's very, very important. So what is diabetes? It's important to appreciate what really is diabetes. And basically, diabetes is a condition where your body is having difficulty managing carbohydrates. And I know carbohydrates is a word we don't get to say too often, but it's important to understand what a carbohydrate really is. And we're going to talk a little bit about that a little further in the presentation, but suffice it to understand that carbohydrates are what we consider a macronutrient. It's the bread, it's the pasta. Ultimately, carbohydrates are broken down into sugar or glucose, and it's there where we fundamentally have a problem or challenge when it comes to diabetes. There are really 2 types of diabetes. There's a type 1 and type 2. And many of you will know that type 1 tends to be someone who's dependent upon insulin. They tend to be a younger person, maybe a thinner person, and they're only about 5% of all cases of diabetes. Most diabetic situations are from type 2 diabetics, and type 2 diabetics historically have been older, a little heavier, definitely linked to lifestyle behaviors like your exercising, but especially your diet. And we're going to talk further about it, but we really have about 38 million type 2 diabetics in this country. And we're going to see that these numbers are not just challenges with the United States, these are international challenges for everybody. And we have to ask ourselves why. The good thing about type 2 is we have a lot of opportunity to reverse it and to manage it with lifestyle. But the reality is you can't do that if you don't understand it. So we've got to learn more about nutrition and understand that we're living at a point in time where we are exposed to so much in our food that if you don't understand what you're doing, it's easy to overdo it when it comes to certain macronutrients like your carbohydrates. This is going to be a short video, so let me go ahead and get it going. So let's talk about prediabetes real quick. The important thing to know about prediabetes is it's very, very common, and if you're not getting checked with appropriate lab work, you really won't know about it. When you're seeing your doctor and you're having your routine checkups, there's a really important test that we started doing no more than 7 to 10 years ago, and that's called the hemoglobin A1C test. And that test is critical because once it hits 5.7 and goes up to 6.4, that's considered prediabetes, and your body's beginning to show evidence that it's having some difficulty managing your carbohydrate load, your sugar load. Once that level hits 6.5, that would be considered diabetes. And when I see patients in the office and we identify this challenge, I kind of say it's kind of good news because it really gives you a chance to make changes in your life with your diet in particular. You're going to start being careful. You're going to be paying attention to your nutritional labels, and you're going to be getting more exercise, simply walking more, getting more rest, managing how much bread you're eating, how much cereal, how much pasta. And I tell people, let me make it clear, when we talk about nutritional things that can get you in trouble, doesn't mean you can't do those things, but what it does mean is you have to begin to be careful with your portion sizes. Your portion sizes become critical when you look at carbohydrates. Diabetes is affecting everybody, old, young, black, white. We're especially seeing higher numbers in our younger people, which again maybe looks at the younger group as far as eating habits. More and more, we're not eating at home as a family. We see the big chains of food and restaurant companies expanding. When you're eating at home, you tend to eat healthier. You have more control over the ingredients you're putting in your food, and you tend to have a more wholesome diet. Looking at statistics as it relates to diabetes, we got about 38 million people who are diabetics, a very significant part of our population. We're talking close to 12% of the United States population. As mentioned earlier, most of the diabetics are type 2 diabetics. We're talking about 36 million. And surprisingly, a lot of people are walking around with diabetes and don't even know it. That's why it's important to get these tests done. The blood tests will pick up on the earlier cases. Sometimes you're going to present with some of the more classic symptoms of diabetes, and that tends to be blurry vision, urinary frequency, and drinking a lot of water as well. Worldwide, we're approaching a billion people with diabetes, you tend to see some of the largest numbers in China and in India. Here in the United States, we see every major group being affected by diabetes, but surprisingly, we don't talk about it much, but it's the Indian population and Native Americans who really have the highest cases of diabetes. So when you begin to see these numbers, just don't think about the numbers, but think about that percentage of people who almost certainly will be coming down with your complications, the blindness, the dialysis, and the amputations. There are really real things happening to people. And as we look at those complications, they translate into dollars as well. We're looking at a significant amount of the American dollar that goes into paying for direct and indirect complications from diabetes. And because all these numbers are going up with cases of diabetes, all the complications go up as well, and the costs go up. And remember, when you begin to come down with these significant complications, it has a significant impact on your quality of life. Sometimes we forget what it means when you have an amputation and you can't walk anymore, or you have to go to dialysis. You know, we know more about diabetes these days, so we can do more, but naturally, we want to put a lot of that emphasis on education and lifestyle changes. So when we talk about the causes of diabetes, the traditional things we talk about are the genetic factors. You know, if your mama had it, you might get it. If your papa had it, you might get it. You see it running in families, siblings. We know as a physician community that anything that destroys your pancreas ultimately destroys your insulin levels. And we know viruses do that. We know if you're a drinker and you come down with complications of your pancreas, such as pancreatitis, that will lead to destruction of your pancreas, which means destruction of your insulin producing capabilities. We also know that as you get heavier and put on more weight, those things cause your insulin not to work as well. That's why you hear a lot of times we say start exercising more. You don't have to lose a lot of weight, but losing some weight can significantly help. But one of the things we don't do a good job of, in my opinion, and 20 years of being in the office has shown me this, we don't do a good job of talking about nutrition, what we eat. You know, all food is not food anymore. And I want to take a moment to just go over a few of the basics of nutrition. Whenever you put something in your mouth, your body is programmed to figure out one thing. Is it a protein, is it a fat, or is it a carbohydrate? If it's a carbohydrate, your body knows how to break it down. Your body's goal is to break that down to its simplest form, and that simplest form will be glucose. Now, when you talk about carbohydrates, there are different types of carbohydrate. And for purposes of this conversation, there are good ones and there are bad ones. Let's keep it simple. And on your left, you pretty much see bread. Bread is a man-made product. It's not natural. It primarily comes from wheat and other mechanisms. And to the right of that is a wholesome food, wholesome. And in this case, it's asparagus. Who likes asparagus, by the way? Raise your hand. I do too. So what do you think is the biggest difference between asparagus and that white bread? Anybody? Who said fiber? Who said process? You said fiber. Okay, so you said process. Why do you say process? What do you mean?
Because to make bread, you have to process a lot of stuff, like the wheat flour, the sugar, the salt, the yeast, all that stuff. You have to do something to it
Right.
to make it go into that form.
And Barbara said fiber?
Margot and my fried
Margot said why do you say fiber?
because because it has fiber in it, digestion takes longer.
Right. And it's important to know that because I don't think the average person knows that. But when you take a wholesome product, you really have one natural ingredient, and that's the product. And in addition to the fiber, you have a lot of macronutrients and micronutrients in there too, and other vitamins. But all that is taken out when you look at a lot of the breads, when you look at a lot of the potato products, the pasta products, and it's important to know that because if it's coming in a box, a bag, or any other type of wrapping, you've got to know what's been done to that product. The good thing about fiber is we have to appreciate there's a word called satiety. Who ever heard that word before, satiety? And what that really means is you feel full. It's your body's natural mechanism to protect you from sugar. Remember, when you are home and you reach for your table sugar, remember that table sugar used to be wrapped with fiber too. And because of that, back then it was more so called sugar cane. And because of that, that cane, if you tried to eat a lot of cane and sugar, your body would get full and you would stop eating. And if you kept eating, you start vomiting that stuff up. That was your body's natural mechanism to protect you. Nowadays, we don't have that anymore. So when you look at the breads and all the different fancy products, we're more in a commercialized system, and then it's more driven toward products. And it's important for you and me to understand all this stuff. And this is happening around the world too. And this will cross over into our processed foods as well. And so in the late 60s was when the US food supply really started being exposed to something even more difficult to talk about when it comes to this, and that was high fructose corn syrup. High fructose corn syrup was beginning to be added to a lot of food products, and it would make foods taste good. It would help processed foods have a longer life expectancy on the shelf. And no one really talked about this, but over the subsequent decades, these high fructose corn syrup products have been ubiquitously added to just about everything we consume. So we have to begin to appreciate that our supermarkets are a huge challenge for us, and we need to know how to navigate it if we want to stay healthy. So high fructose corn syrup is associated with obesity. It's associated with liver disease because when you ingest all these sugars, your body has to metabolize it. And part of the metabolism is you take that sugar and it gets stored or packed into your liver. And we don't talk about it much, but more and more now, especially in younger people, we're seeing more what we call fatty liver disease. And it actually is serious because a certain number of people who get these conditions will get cirrhosis and require liver transplants. And we're going to see an explosion of this. And that's why it's important to learn all this, because you have to educate the next generation of younger people. Otherwise, they are the next generation of medical complications from what we're seeing here. But high fructose corn syrup definitely is related to diabetes, heart disease, and gout as well. So I don't know, by a show of hands, who normally takes a look at their nutritional labels and reads them? And that's important. Put your hands down. Now, for many people in the audience, have you been doing that for 10 years? Raise your hand if it's been that long. Or has it only been maybe 2 or 3 years? Right. So for many of us, this is not something we've been doing for a long time, but it's important when you're looking at the label to look at the amount that makes up a serving. You know, you want to look at the calories that are in there, and you want to pay attention to the fiber, to the sodium, and you always want to look at the added sugars. Added sugars are a big deal, especially when you begin to talk about the drinks that we do, the fruit juices and things of that nature, because when you're drinking your calories or drinking your sugar, you can drink tons of that stuff and not even really appreciate it because you're going to feel normal. But if you're, checking your sugars or monitoring your sugars, in many cases, especially if you're sensitive to sugars, your sugars are going up. You don't even know it, but it's because of that product you're drinking. Things like orange juice, soda, Gatorade. I've had people as young as 30 turn into diabetics from drinking Gatorade. And when you turn a Gatorade around and you look at this information, it will tell you that 70% of your daily requirement of sugar is in one bottle of Gatorade. And I've had young, healthy people, because it tastes good, drinking 2 of those a day. And let's be clear here. Most people do this because they just don't know. But once they find out, they change things and they do better. But you got to catch them early, because if you catch them early, you can reverse all this stuff. If it goes on too long, it turns into diabetes. So when we talk about lifestyle choices, we see it all around us. The French fries, these are all the things we like. These are all the things we've done since day one. When I see patients in the office for about a year or so, I was doing this informal survey, and I would say to them, what day of the week do you think is most responsible for getting us all hooked on sugar? What day of the week would you say? Anybody? Pick one day. Friday? Who said Saturday? Why you say Saturday? Close. Anybody else for Saturday with a better reason than that? That's not bad though. But if you think about it, and I've talked with people from Europe on this too. On Saturday, even for me as a boy, you would wake up and you would go watch cartoons. And when you watch those cartoons, you would have not just your bowl of cereal, but your whole box of cereal. And you would be hit by all the commercials about cereal while you sat down there. And that continues to this day. So a lot of people, we get hooked on sugar from a very early age. And at some point, we got to realize it, because the American body habitus used to be pretty slim, but we've gotten bigger over time for a lot of different reasons, including the excess calories that we're taking in now. All these things with the added high fructose corn syrup and other things, and not appreciating a serving size and just eating way too many calories. Our bodies are trying to adapt to it all, and part of that adaptation has turned into diabetes and diabetic challenges. So just a few words I want to make sure you appreciate. It's important to understand what glycemic index is. Who's heard of that terminology before, glycemic index? Very important word. And what that really does is it helps you understand how fast your sugars will rise based on the product or food that you're eating. And many of the things that we just saw, such as your pastries, your breads, and those things without fiber, have a high glycemic index. And when you eat that stuff, you'll see your sugars shoot up to the moon if they could, especially if you're eating large portion sizes. Now, if you're eating a product that has a high glycemic index and you're eating a small portion, you may not quite see that, but generally speaking, you've got to be extra careful when you're dealing with those kind of foods. And those are the foods that we like. So you have to exercise a lot of discipline. The foods with low glycemic index, they tend to be your broccolis, your kales, your vegetables, your certain fruits, your beans, and your nuts. But a lot of the things we like, a lot of the things that come in boxes that are processed and are sweet, those are the things you gotta watch out for. Glycemic loads more so speaks to not just the glycemic index, but the portion size or the quantity, which can get us in trouble too. So exercising is important. There used to be a time when not everybody had a car. There used to be a time when you had to walk. You had to do more physical stuff. We didn't have the privileges and conveniences of technology. So nowadays you gotta find ways to get your exercise in. That's why gym memberships are what they are. That's why people are walking in the neighborhoods, and that's very, very important. So whatever it is you like to do, continue to do it. And the more you like that exercise, the more you do it with other people, the more enjoyable it tends to be. So as we talk about diabetes a little bit more, a lot of times at the end of the day, you're gonna have diabetes. And the question is, how do you best manage your diabetes? And there are a few things you gotta understand. And I will say that diabetes, we're at a point now where we know so much more about it. And we need medications, and when they're appropriately needed, they've got to be used because they're going to help prevent those terrible complications we talked about. We're in a point in time where we're seeing medications like Mounjaro and your Ozempics. They're doing a wonderful job in helping us manage diabetes. They're doing a wonderful job also because they help curb your appetite, by the way, which ultimately leads to weight loss, which helps all this stuff out. But when it comes to diabetes and you need medications, medicines make a difference. We know now that there are certain medicines that are going to give you added protection of your kidneys, ACE inhibitors. We know now that there are new classes that are going to give you additional protection when it comes to protecting your heart. And those things are very important because with diabetes, the risk of strokes also goes up too. And for a lot of people who need insulin, there's still this phobia, I think, about what needles used to be like 30 and 40 years ago. The world has changed and the technology has changed. These days, you can get an injection if you need one and not even feel the needle, and that's a beautiful thing. And the technology is changing a lot too. Many of you may have heard of these new continuous glucose monitors, for example. You can wear these and not have any pain and get 24-hour insight into how your sugars are doing. And that same monitor could be linked to an insulin device that automatically feeds your body insulin. So it keeps everything as natural and physiologic as possible. That's what this pump here is trying to talk about. But ultimately, medications make a difference. They need to be managed and monitored, and it helps keep you around for a while. So we talked about the blindness you can get, the kidney disease, the amputations are real, nerve pains, and we have medications and strategies to deal with all these challenges. The only thing is, to be quite frank with you, is as this is happening, you will notice your pill count is increasing, and some people don't like that part. But it does help to preserve life, preserve quality of life, and things of that nature. So preventing diabetes, exercise is important, balanced, healthy diet, and getting your exercise. And and seeing your doctor, regular checkups. We're at a point in time where regular checkups just seem to be so much more valuable now with all the things that can go on around our health. Just a regular checkup is critical. So as we wrap up, I just want to remind you lifestyle choices are important. Understanding diabetes and your nutrition is really important. Chronic diseases are happening, and we're trying to live, because if you think about it, many of us have gone 4 and 5 decades of life before we even begin to think hard about these lifestyle changes. So in addition to the aging process, a lot of the damage has already been done, and we're just trying to mitigate those challenges as we go forward. And it's a process. It's a process. So hemoglobin A1C test is very, very important when you have diabetes. Most of us know that with diabetes, we want to see that number less than 7 or 6. But as you get older, we really want to see a less than 8, because if we do too good of a job as you get older, we can actually hurt you. You probably know that cholesterol levels need to be optimized, and in many cases, your cholesterol level can be normal, and we're still giving you a cholesterol medication because we know that that can offer some protection from heart disease and stuff like that. And those medications, for the most part, are pretty safe. You can potentially have some muscle aches or some liver abnormalities, but if it's not too significant, it tends to be of a benign nature. Eye and foot checkups are important as well when you're a diabetic. So I wanted to thank you all for giving me your attention. Hope you all learned something today. Now maybe we'll open it up for questions now. So I guess you can raise your hands and we can kind of go from there. Any questions?
Yes, I have one question. Is there any, I've been trying to deal with the prediabetes and weight and all that. Is there any good calorie and carb count that is best for your body on a daily basis?
Yeah, I would say that for the average person, we're talking about a 2,200 calorie diet. So generally speaking, anything less than that's going to be important.
Okay.
And one of the things we got to be honest about, I think, as we all are getting older, we're never going to probably lose the kind of weight that we think and want to do. But I can tell you, you might if you want me to. And you might need help with medications to help get you there. And that's where the your Wegovy medications and your Zepbounds, they do help in those situations, because when you're trying to lose weight as you get older, you're also dealing with your metabolic changes and things of that nature too. So, and then you got to be careful.
You didn't say carbs. How about it? You said 2,200 calories, but carb count.
I mean, carb counting is important. I couldn't give you an exact number of what might work best for you. But keep in mind too, as you're getting older, and sometimes you're trying to lose weight, and you're not losing the weight you want, but you are fitting your clothing a little different too, because you got some body composition issues going on there too. So I hope you're fitting better in those clothing now.
You mentioned earlier when you talking about people being pre-diabetic and some other folks and the idea of reversing. At what point is being able to reverse it not a thing?
What do you mean not a thing?
So, or is there a point? So, I mean, obviously, yeah. If I'm somebody, I got my leg amputated, I definitely went too long. Mm-hmm. But say somebody's had diabetes for 5 years and it hasn't really been under control, but they haven't got to that point. Is it still reversible?
Well, I should have been careful earlier too. I try to be real careful when I use that word reversing, because nothing is really reversed. What you're really doing is you're better managing that situation with lifestyle intervention, which you'll have to do for the rest of your life. So it's not like one day you have it and then it's totally gone. Did that answer your question?
Yeah. So I guess so then, if I'm understanding, then with the management,
Mm-hmm.
I could get myself to a place where my numbers don't qualify as being diabetic.
Right, right. And this is a good point to raise, because I've had a patient who comes to mind, and that gentleman was 55 years old and had, based on his lab work, terrible diabetes. His A1C was like 17. And he wasn't even taking medication. And well-educated guy. And it turns out he had started drinking these energy drinks. And once we realized what it was, he stopped doing that, and his A1C went down to 5.
Wow.
And the question is, how do you label this guy? How do you label him? Do you treat him like you do all the other diabetics, as far as still give him that diagnosis and say it's lifestyle managed? Do you put him on a cholesterol medication? Do you keep him going to the eye doctor every year? But we're just kind of managing his A1C, but that's the importance of nutrition.
I come from a family of diabetics and hypoglycemics.
Okay.
What they understood was if you are going to have your regular portion of carbohydrates, if you also include protein in the meal, it helps to mitigate that. Is that true?
You know, that is so true. That is so true. I didn't go too much into that. But
Repeat it.
one of the things that we have to appreciate, and they taught us this stuff in medical school, is when you combine carbohydrates with protein and or fat, it can, proteins slow your gut motility. It slows everything down. And by doing so, in the setting of a carbohydrate meal, your body has more time to work on that and prevent the rising numbers that are associated with the carbohydrate load. But so anytime you're eating food and you have carbohydrates, it's always a good idea to eat your proteins first or combine it in such a way, because that will help manage your sugars. It makes a big difference, big difference. Another question?
First, I did get told that I was pre-diabetic, and I really, really looked through everything that I was doing. And what I did was similar to the patient you were talking about. It wasn't an energy drink. It was sweet tea.
Mm-hmm.
And I got rid of buying sweet. I love iced tea, but I make it myself. I control what goes in it. And I'm okay now. And it brought my numbers back down. And so it really does have that. But now the other thing is I have my son in his early 40s. He's been diagnosed with fatty liver. And he needs to lose like 30 pounds. But what should I suggest to him? Should I suggest going to a doctor for more support and help with that?
Well, I think you're right. I think he still needs to be under the management of a doctor, because fatty liver disease is still a really new concept for us all. But more importantly for him, he's got to get educated on what he should be eating or not eating, so that we know there's a good possibility this is going to be reversible for him, as long as he can begin to eat healthier. Some of the Wegovy type medications are being looked at to help treat fatty liver disease, and we're going to know a whole lot more in the coming years. But in the meantime, him eating a healthy diet and exercise and keeping his weight down will be critical. Yes.
Can you just speak a little bit about sugar substitutes? Because I think sometimes people think, well, I can get away from the sugar, I'll just keep the diet first.
Well, that's a good question. You're right. You got to be real careful with the substitutes as well. It's just another challenge that we don't know all the details, but they're not as healthy as well. So in general, I think you need to try to avoid all those things. And if you are going to do it, just maybe do it in really small portion sizes. But again, more and more, we're finding these products are not as safe as we're being told they are. And we're not getting the kind of support, maybe from a legislative standpoint, that can help protect us as consumers.
So I've been pre-diabetic, say between A1C 5.7 to 6.1 or so for over 10 years, maybe 20 years. And it has pretty much just stayed bouncing around in there and been too concerned. But in more recent years, I started, because of different specialists and issues in different areas that seem to be very compartmentalized, like one person dealing with calcium, one dealing with cardio, things like that, that I'm taking medications that are new, relatively new, and I've noticed that in the past, say, 6 months, my A1C has jumped up to like 6.2, and I'm concerned about how these new medications may be possibly interacting, or is that unlikely? The problem is that having specialists who deal so singularly with their own little area and are not looking at the more integrated picture of a person, you have to be your own advocate.
Yeah, you do. And, it's always possible that the other medications are getting in the way, but a lot of times part of this is just happening for other reasons. So you want to take a close look at your diet and maybe your exercise habits too. And I don't think we talk about it too much, but when you talk about prediabetes, the real concern is in that 30 and 40-year-old. I think when we begin to see people above the age of 55, 60, it's still important, but it's not as critical, because remember, the big challenge with prediabetes is it's the gateway to diabetes, and then it's the usually long-term complications of diabetes that really get you into trouble. So we still respect that A1C prediabetes for people in their late 50s, but the truth is it's not as critical. But your point is well taken.
You spoke about the corn syrup, and that is in most of the sodas that we drink. Nowadays, some sodas are being made with cane sugar. Is that any better than the corn syrup?
It really isn't. The question was, high fructose corn syrup is in a lot of sodas, and nowadays there's another alternative type of sugar that's in it. Sugar is sugar. The body doesn't discriminate, and when they see sugar, it's going to react a certain way. It just turns out that high fructose corn syrup is a more concentrated sugar and even more of a concern. But the truth is, they're all going to be a problem. So if we make that decision to consume soda products, we have to understand the risk that comes along with it. Doesn't mean you can't do it, but you got to be real careful.
What about drinks like Spindrift and LaCroix that are basically seltzer waters with some fruit juice or something in them, even though they don't have a lot of calories? Are they bad for diabetics, pre-diabetics, and children?
Not too familiar with those products, but based on what you just said, as long as the sugar content isn't bad, you should be okay. And that's why reading that label is so important. It's going to tell you a lot. So the lady in the red dress, no hard questions.
No, the question is that's what I drink. Seltz water. She describes seltz water. Just different types, different brands.
Thanks, that's my wife back there.
What did she say?
Say it again.
I'm just saying that it's seltz water. There's no sugar in those products that you just listed, so they're not.
Are they okay for youngsters like 10 and 11,
Yes,
12 years
it's just basically water and fruit juices with no sugar.
old? Okay, but the carbonation and the phosphorus and all that stuff?
I'm not a pediatrician, I'm
Okay.
an internist, like he is, so
Okay.
I can't tell you that it's okay, so check with your pediatrician.
Okay, got it.
But it shouldn't hurt you for diabetes or pre-diabetes.
Okay. So when you look shopping stuff, I read the different things, but nowadays, when you like buy some pasta, they have it where it'll say it's got protein or slow digesting with the sugars and whatnot, better for, are they worth the extra money to buy those things? Do they really help?
Well, that's a good question. Anybody in the audience want to take a stab at that before I do?
Can you repeat the question?
The question is, with the new pastas out there, some of them are advertising that they're healthier and safer. I'm familiar with those products. I was just curious what anybody else thought about that. And so I'll go ahead and answer it. I think those products are truly important for us to take a look at, because remember, pastas are going to break down into sugar because they're a carbohydrate and they're highly refined. Nowadays, you can buy certain pastas, well, certain, I guess I can call them pastas, that are made out of protein and won't break down into sugar, and might be a little different of a taste, but very, very similar. So I think we have to be looking at those products.
Okay, so they're worth.
I think they are. It might be a little more expensive, but it's worth it. It's worth it.
I think the chickpea is the best.
Yep, me too. Me too.
To me, doesn't taste much of a difference.
Right. It makes a big difference.
Chickpea, yeah.
Question in the back?
Lasagna, chickpea, all kinds.
I'm really concerned about, remember, mercury that I'm seeing now about.
About what? Ozempic?
Lose weight. It made me really nervous. And I don't know if that's within your purview to discuss it, or even, but no, how are these drugs being tested on? What are the side effects? To just for people that are taking it to control their diabetes, not patients don't want to go the way.
Right. Yeah, those medications have been around for a while. They've been around for at least 10 years, you're right. We don't have the long-term studies, but what we do have are the short-term studies. And I tell people, you gotta remember, we know a lot about these medications. We know that there's gonna be a high probability of some nausea, some GI possible side effects, but we also know a lot about the good things they're doing too. And anytime you take a medication, as a doctor, we know the good has to outweigh the bad that you're exposed to. We know that when you look at these medications, if you have a certain family history of a certain thyroid problem, we know that that medication's not for you. So when these medications are managed appropriately, they are safe. And that goes for just about any medication. That's what's supposed to happen. Mm-hmm. Do they manipulate?
The pink.
They manipulate things going on in the pancreas.
Well, you know, most of their manipulation is outside of the pancreas. Most of it, yeah. Question in the back?
In regards to pets, I read something about pets causing diabetes.
No, I haven't heard that one. I mean, that's the thing too. We're gonna hear a lot. No, I haven't heard anything about that. Yeah, we talk about marketing of different products that aren't good for you. You're gonna be hit with that. You're gonna hear all kind of other things too. And it's up to us to try to make sense of all this stuff. So I don't know if there are any more questions. I know we're kind of wrapping up. I'm good to continue. You just let me know. Any more questions? Well, I thank you for your attention. I hope you all learned something. Thank you.
We did.